I will be demonstrating joint mobs for the upper extremity. Joint mobs are used to increase the mobility at a specific joint. One contraindication is you do not want to use it for individuals who have hypermobile joints. So multidirectional instability would not be a good patient for this to be used with. Grades 1 and 2 are used for pain relief, and grades 3 and 4 are used for increase of motion. With the upper extremity, I'll be demonstrating this on the shoulder, and you want a loose packed position with joint capsule relaxation. So I'm going to pull your arm out here. Hold it here, and gently move it inside the capsule. And you can increase and decrease motion for the specific grade that you're going for.
I'll be demonstrating how to correctly instruct a patient how to perform upper extremity functional activities. There are 3 goals for functional activities. 1 is to attain full functional levels of flexibility, strength, and endurance. 2, achieve full functional ability of normal speed, power, control, and agility. And 3, restoring patients' confidence in their performance. So for upper extremity, here are some examples. Juggling, PNF patterns with TheraBands, rock, paper, scissors, and dribbling or throwing against a wall. Today we will be juggling and playing rock, paper, scissors. So say if there was a wrist injury, we're going to play rock, paper, scissors. I really want you to hit it and get that movement in your wrist, okay? Okay, that's rock, paper, scissors. Now we're going to juggle. My patient cannot juggle with 3 balls, so we're going to juggle with 2. Go Saints. This is how to properly instruct your patient how to perform functional activities.
We'll be demonstrating some upper extremity muscle strengthening exercises. Especially for rehabilitation purposes, it's important to go with a low weight, high rep. We stay away from the 1 rep, high weight type of strengthening exercises. So first we're going to start with some open kinetic chain exercises because they are easier on the joint. So have the patient take dumbbells, and what you're going to do is you're just going to lift them over your head and come back down. Okay, come back and go up and back down. There you go. Like I've given them 2s, so you generally want to start with a lower weight, and I would have them do 20 sets of these, reps of these, and then slowly progress them to a higher weight. Next, we will be doing a close kinetic chain exercise. So we will be doing push-ups. So I'm going to ask you to get on the floor. And for this, they can start on their knees and progress up. So yep, we'll have you in push-up position.
I need like a pad.
Go down, hold, and then come up. Down, hold, and up. Okay. And especially when they're on their knees, you can definitely have them do more reps.
I will be demonstrating how to perform a D2 upper extremity PNF pattern. The purpose of a PNF pattern is to help facilitate or create movement at a joint which lacks the range of motion. D2 upper extremity PNF pattern is a diagonal movement starting at the opposite ASIS, going into flexion, abduction, and external rotation at the shoulder with finger and wrist extension. When coming back down towards the opposite ASIS, it is internal rotation, adduction at the shoulder with finger and wrist flexion. So to start off, you have the patient just doing the movement, and you have them relax, and you're doing the movement for them. Coming back down. Making sure that when you go towards the head, the arm isn't all the way up here or too close, about a fist width away from the ear. And back down. Once the patient is comfortable with this, you start moving with me. Good. Making sure to lead with the thumb. Once the patient is comfortable with this, you want to start applying resistance. Now when applying resistance, it's just a simple weight shift. Don't pull too much with your hand, just allowing them to move you with their resistance. Good. This is upper extremity D2 PNF pattern.
I'll be demonstrating a proprioceptive exercise for the upper extremity. We use proprioceptive exercises to help restore agility, balance, and coordination for the joint. And so for the shoulder, we always start with an open kinetic chain. So I'm going to ask, can you please stand up? and then we're gonna have you close your eyes. We'll use the shoulder. Okay, can you just bring the shoulder out here, and I'm gonna push you in a ton of different directions and just try to not let me, okay? Does that make sense? And so for this, you just push them in any direction. And the goal is you don't wanna have big movements. They're just tiny little movements that they can get used to. Next, I'll be demonstrating a proprioceptive exercise for the upper extremity. This one will be a closed kinetic chain exercise, which always follows a open kinetic chain exercise. For this, the patient will put their hands on a medicine ball, and they will slowly walk the ball forward and then back. And the proprioceptive exercises are used to help improve patients' agility, balance, and coordination, and help improve joint movement. And this is how the patient should be doing it. They should be able to balance on the ball, and as this exercise becomes easier for them, you can increase the ball size.
I'll be demonstrating the different aspects of massage, including effleurage, petrissage, and friction. First, you'll start by using skin lube on the patient to soften the tissue. And you start by doing effleurage, which is a gentle motion, and it just relaxes the muscle and increases both venous and lymphatic flow. And after effleurage, you move into petrissage, which is deeper and it's a more kneading motion. And this is used to relax the muscle more. And then you go into friction when you find a certain area that's tighter than the rest. And this decreases scar tissue, so it can be used after surgery. And you move in opposite directions with your fingers. And then you always want to go back in the order that you came. So after friction, you move back into petrissage. And then back into effleurage. And you never want to take your hands off the patient.